My name is Jessica. I am going to be teaching your spine surgery class today. I am a nurse on the orthopedic unit at Saratoga Hospital. Saratoga Hospital has a patient portal. This is a secure website where you can access and view your medical records online after you leave the hospital. Information on the patient portal includes information like laboratory results, medications, allergies, your discharge instructions, and some of the physicians or providers dictated reports if they do them electronically. If you would like to enroll in the patient portal, please call the patient portal hotline at 518-886-7999. The reason we do this class is hope to ease your anxiety before you have surgery and prepare you for surgery and your hospital stay. The rooms on D3 are all private rooms. After spine surgery, your stay would start off in the intensive care unit, and then when you are medically stable, you would be moved to this unit on D3. Each room on D3 does have its own bathroom. Visiting hours for the hospital are technically 10 a.m. to 8 p.m. However, once you are on D3, we are not picky about these visiting hours due to the fact that all of our rooms are private. If it becomes flu season, we do have flu visitor restrictions, which would be posted. Flu visitor restrictions consist of no more than 2 people at the bedside and no visitors under the age of 12. This is only during flu season. If you have a coach and that's a friend or family member, they may stay the night if they want to on D3. We have a reclining chair in every room. These whiteboards are in every room to help the staff communicate who is caring for you and your plans. So for example, the nurse would fill out their name, the patient care assistant would fill out their name, the care manager would fill out her name, and we would put your anticipated discharge day on the board. If you're going for any tests or treatments, for example, having lab work done, we would put that on the board. And then physical therapy, occupational therapy, and the nursing staff would work together to fill out your activity level. The bottom section where it says family questions or comments is used to discuss your next available pain medication, and pain will be discussed a little later in the class. The nice thing with an elective procedure is you can plan on what items you may want to bring from home. So for example, the hospital provides everything you would need for your normal hygiene. So for example, in the morning, you could wash up with what's called bath in a bag, which is basically a package of warm wipes that you can use to wash from head to toe. We also have items like lotion, toothbrush, toothpaste, mouthwash, denture tablets, denture cups. We do not carry a couple things that I would recommend bringing with you. We do not carry deodorant, and a lot of people would like deodorant during their hospital stay. And we do not carry lip balm, and some patients complain that it is very dry after surgery, and this may help you feel more comfortable. Entertainment on the unit is we do have a flat screen TV in every room. This flat screen TV does have cable. It also has Wi-Fi in every room, and we do have a book or a magazine cart. A couple other things that you may want from home is some people like to have their own cell phone from home, even though we do have a phone available in every room. Cell phones from home, a common mistake we see made is people remember to pack up their clothing, other belongings, and their cell phone is remembered, but the cord is forgotten. So please make sure you remember on discharge to pack up your cell phone cords. The other thing that we see happen is sometimes patients put their personal belongings that are smaller on their meal tray and then forget to take them off. This meal tray then goes down to the cafeteria where it could end up in the garbage or the dishwasher. So please try not to store your own personal items on your meal tray. As far as meal times on D3, breakfast comes around 8 o'clock in the morning, lunch comes around noon, and dinner comes around 5:30. In between meals, we have plenty of snacks available. We can call down to the cafeteria, send them a message saying that you need another meal tray or a snack, and we have plenty of snacks available on the unit, such as ginger ale and crackers, ices, ice creams, yogurts, jellos, puddings. It's good to bring in some of your own clothing from home in order to get dressed in your own clothes at some point after surgery. Usually this would not happen the first day, but at some point you're going to get dressed with occupational therapy, and also the nursing staff could help you get dressed into your own clothing. You just want to think about loose, comfortable clothing. So even though skinny jeans are in style, that's not going to be the most comfortable thing for you after surgery. You want something like gym shorts, sweatpants, pajama bottoms are fine day or night. Pajamas are usually good because they're a soft, comfortable fabric. They're loose. They have an elastic waistband, so they're a little easier to get on and off. As far as footwear, sneakers are usually the best because they have a non-skid bottom and they're supportive. A shoe that would be inappropriate is something like flip-flops. That could be a fall hazard after surgery. Some common questions that we get is, how long will you be in surgery? For a one-level spine surgery, it's about 2 hours. More than one level could be 3 hours or more. It is important to discuss this with your physician ahead of time. The best spot for your family to wait while you're in surgery is usually the waiting room. After surgery, you go to the recovery room to recover before going to the intensive care unit. In the recovery room, they're going to do things like monitor your vital signs to make sure that you're stable before sending you on to the intensive care unit. After surgery, another thing that's common is to have a Foley catheter. A Foley catheter is a tube inserted into your bladder to drain all the urine. This usually stays in for about 24 to 48 hours after surgery, and then the nursing staff discontinue this device. The other thing that you'll have after surgery is IV fluids running. The purpose of the fluids is to help with hydration after surgery. During surgery, you have fluid loss and blood loss, so this is to help hydrate you. These will be stopped about 24 to 48 hours after surgery, depending on how you're doing eating and drinking, urinating, and how your lab work looks. Another common question we get from people is, can you take your own medications? The answer is usually no. What should happen is when you come in prior to surgery to pre-procedure testing, they will take a list of your medications, enter those medications into the computer, and then the provider should order those medications after surgery, unless there is a reason they do not want to order them. If when you are here you think you are getting a medication that you shouldn't be, check with us and we'll find out the answer. If there's something you think you should be taking that you don't think we're giving you, also talk to us. Never take your own medication without discussing it with us first. You don't want to take something that you are getting or the doctor or provider purposely did not order. After surgery, you're going to hear us ask you a lot to rate your pain on a scale of 0 to 10. 0 would mean no pain, and 10 would be severe pain at rest and excruciating pain with movement. It is unrealistic to think that your pain is going to be a 0 after surgery. You are going to have surgical pain. When you first have spine surgery, you might have a device that you can push a button in order to get pain medication. After that device is stopped, most of the medications that we give after surgery are usually by mouth and as needed, meaning you need to ask for them. So it is very important that when you're in pain to ring your call bell and let your nurse know that you're in pain so we could do something for that. It may be giving a medication, it may be repositioning, or it may be using ice to help with the pain. Ice can help with the pain, swelling, and bruising after surgery. With any medication, there can always be the risk of having a side effect. If you think you are having any sort of side effect, it is important to let the nursing staff know that. So for example, if you're nauseous, let us know and we could give you a nausea medication. If you're vomiting, also let us know. We could give you a medication to help with that, and or talk to the provider about changing your medication. If you're itching, let us know and we could give you a medication to help with the itching, and or talk to the provider about changing your pain medication. Any side effects, please discuss with us. After surgery, it's very important to use your call light. So our little motto at Saratoga Hospital is call, don't fall, meaning we want you to ring your call light and wait for staff to assist you. Do not get up without staff assistance. To prevent falls, we also alarm beds and chairs, so that way if you forget the rules and do get up by yourself, this alarm would go off and alert staff that you are getting up, and we would come in and be able to assist you, so that way you can ambulate safely or get up from the bed or the chair safely. After surgery, you do get a lot of equipment. Some of this equipment is from the nursing staff. In this section, I am going to discuss the equipment that the nursing staff is responsible for, because care management and therapy will discuss other equipment that you have after surgery. In the picture on the bottom left is a picture of an anti-embolism stocking. You will have these stockings on both legs after surgery, and they will be either up to your knees or up to your thighs. The purpose of these stockings is to help prevent blood clots after surgery. You will also wear these stockings when you go home, usually for 2 to 4 weeks after surgery. Another item you will have to help prevent blood clots is a sequential compression device. These will be wrapped around your legs and hooked up to a machine. The machine pushes air into these sequential compression devices, and the air helps compress that and therefore help with circulation. These will be on when you're in bed here in the hospital. You do not go home with those. In the bottom right is a picture of an incentive spirometer. We will teach you how to use this to exercise your lungs after surgery. The purpose of this is to exercise your lungs and help with deep breathing and coughing, and therefore preventing infections after surgery, such as pneumonia. After surgery, you can get out of bed. It will be with assistance of staff, or by physical therapy or occupational therapy. Your restriction after surgery will most likely be no bending, lifting, or twisting. After surgery, you will have a dry, sterile dressing on your back, and you may have a drain. There's 2 different types of drains. The one on the left, a Jackson Pratt, or the one on the bottom right, which is a Hemovac. If you have a drain, that will remain in until the provider removes it. The dressing change will also first be done by the provider, and then on your discharge instructions, it will let you know when you can take off that dressing and are allowed to shower. After surgery, it's very important to help prevent infections and blood clots. Hand hygiene is the best way to prevent infection. This can be done by doing hand washing or using hand sanitizer. It's not only important for you to practice hand hygiene, but also your visitors, yourself, and the staff here. For preventing blood clots, it's important to move. Therefore, activity with physical therapy and occupational therapy, doing activity with the nursing staff by getting up and walking to the bathroom and or walking into the halls, and then doing exercises on your own in the chair or in the bed. You should also not cross your legs, and it is very important to wear the anti-embolism stockings here in the hospital and when you go home from the hospital, and then wear the sequential compression devices while you are here in the hospital. Since discharge will happen, it's important to get your home ready before you come to the hospital for the surgery. Getting your home ready can consist of getting rid of trip hazards such as loose carpeting, thinking about who will care for your cat or dog, because you should not be walking your dog after surgery, and it would be breaking your precautions to do the cat litter after surgery. Also, who's going to cook your meals? Should you think about who can cook for you, or do you need to go to the grocery store and buy some things now that you could cook and put in your freezer? Or do you need to have a friend or family member bring you food? So it's important to do things like that to get your home ready prior to surgery. Most people do go home at some point after spine surgery. Very few people will need rehab after surgery, meaning going to a facility where someone cares for you for another week or 2 after being discharged from the hospital. Care management will discuss this more. Thank you.
Hello everyone, my name is Donna Trice. I'm the Orthopedic and Spine Care Manager for Saratoga Hospital, and I will be seeing you when you come in for your spine surgery. When you usually move out to the orthopedic floor, if you are going to be. What I will help you with is make sure you have what you need as far as equipment, things like that, to get you safely out of the hospital and on your road to recovery. Generally, majority of folks go right home from the hospital. The There's not a lot of home physical therapy or outpatient therapy initially with spine patients. It's just more your following spine precautions, frequent position changes, walking, things like that. If for some reason it does come up where you may need a home safety eval by a physical therapist or home nursing, then that is something I can check with the doctor, and we can order that and set that up through a home care agency if needed. The other option is, and it doesn't happen a lot, maybe in a couple percent of our patients, is somebody going from the hospital to an inpatient rehab facility to get further therapy and care until they're safe and ready to go home from the hospital. Again, in both of those scenarios, it's not the majority of folks. The majority of you, what I would be helping you with or making sure you have is your equipment. The majority of equipment you would need will be a two-wheeled walker and a commode. A commode is like a portable potty. You can use it at the bedside, but what most of our patients do is take that portable bucket out that it comes with and place the whole apparatus right over the toilet. You can adjust the legs, and then you have arms to hang on to. The commode can also be used in the shower, so it does actually have 3 uses. Majority of our patients, though, as I said, use it over the toilet. We do have on the D3 orthopedic unit have wheeled walkers and commodes in all the rooms. So if you already have that equipment at home, you don't necessarily have to bring it in. The only time you would need to bring in your two-wheeled walker is if for some reason you're borrowing it from somebody, or you have gotten it delivered brand new from the spine office. They have ordered it for you and a vendor has delivered it and they didn't measure it to you. Other than that, you don't really need it until you would get out of your car when you get home to walk into your house. So what the spine office has started doing recently has checking with the patients to see if they already have a wheeled walker and a commode at home or have access to one. If they don't, what they are doing is ordering it through a vendor in the community, and then the vendor is should be contacting you ahead to coordinate delivery of the items, whether it be to your home before you come in for surgery or to the hospital maybe on day of surgery. And what I will do when you come into the hospital after you have surgery is I will check with you to see if you've already gotten those items, if you need them, or if you don't have them, we will investigate and find out what happened, or I can order those after surgery. Majority of people I find that need those are going to be your lower back fusion patients. And occasionally, sometimes if somebody has a larger neck surgery or something like that. But the office, again, should be checking with you on that and hopefully ordering that for you. But again, I will follow up with you on that after your surgery. Insurance, I deal with a lot of the insurance issues after your surgery here at the hospital. Doctor's office, the spine office gets prior auth for your surgery if needed. And then it's my role to make sure that the insurance company gets the clinical information they're looking for in order to know you had your surgery and pay your bill and everything. If it's a workman's comp case, which I get a lot in my spine surgery patients, it's a little bit more involved, and each of those is a little different. So I have to usually find out, have a claim number, accident date, contact person, find out their process for ordering equipment, and checking on your discharge medications to make sure it's all covered. So that's a little bit more involved. So any and all information would help me with that. Would be helpful if you can give me any information on that, even before you come in for surgery is great. Orthopedic rounds, you may see the charge nurse and I make some rounds in the morning around 9 o'clock to possibly see you on this unit. If not, I would be in to see you at some point, usually after you move out to the orthopedic unit, maybe on post-op day 1 or 2 or something like that, and check with you to go over your information, make sure you have your equipment, etc. Discharge goal time in the hospital is 11 o'clock. Doesn't mean we always get you out of here at 11. No, but that is our goal in the hospital. You won't get charged another day if you're not out of here by 11 o'clock, but we do have to mention that to you. I do want to mention, if you do have any questions or concerns before you come in for surgery and need to contact me, please contact me at 518-886-5734. My name is Donna, and again, my number is 518-886-5734, and I hope you have a good day. Thank you, and I'll see you when you come in for your surgery.
This is Randy, physical therapist here at Saratoga Hospital. I will be reviewing the post-operative information for physical therapy and occupational therapy services following your spine surgery. You will be seen by both physical therapy and occupational therapy services following your surgery. Physical therapy will be addressing mobility, including walking, transferring in and out of bed, standing up and sitting down, bathroom mobility, car transfers, and negotiating stairs. Occupational therapy will address dressing, personal care, bathroom and kitchen mobility, and assist you with utilizing adaptive equipment to perform these everyday activities. Therapy encourages you to bring in any adaptive equipment such as walkers, canes that you may use prior to your surgery. Occupational therapy also encourages you to bring sneakers and normal clothing to practice dressing following your surgery. After your spine surgery, you will have movement restrictions in which you need to follow for the weeks following the surgery. We use the acronym BLT, which stands for no bending, no lifting, and no twisting. We usually discourage people from lifting greater than 5 to 10 pounds, and we also discourage sitting upright for no greater than 40 minutes. Both physical therapy and occupational therapy will guide you on positional changes and techniques in which will allow you to move with as little pain as possible. We will also coordinate our services with your nursing care and your medications to allow you to move with as little pain as possible. Both physical therapy and occupational therapy services typically begin post-operative day 1, but there are many occasions where we will see you the day of your surgery as well. You will be seen by physical therapy and occupational therapy services 1 to 2 times a day until your therapy and mobility goals are met to allow you for discharge home. We also encourage any family members, caregivers, and or friends to be present during your therapy sessions to allow them to observe mobility techniques for discharge home. Good luck and see you following your surgery.
Hi, my name is Lauren Foley. I work as a dietetic technician here at Saratoga Hospital. These are just some nutrition considerations for surgery. So right after surgery, some of you may be experiencing nausea, just what with coming off of anesthesia, being on pain medications, other medications in addition to that. If you feel like your nausea is severe enough to really prevent you from being able to eat your meals, I encourage you to talk to your nurse about taking anti-nausea medications. Zofran is a very common one that we do give here, and it can be quite helpful, especially if they time the anti-nausea medication with your meals. Also, it might help some of you to maybe break up your meals into 5 or 6 smaller snack-sized meals throughout the day, and that would simply mean eating, a small snack every 2 or 3 hours rather than focusing on a large breakfast, lunch, and dinner. It can just help make it a little more manageable, a little less overwhelming for you when you're not feeling so well. And we do absolutely have the option of having snacks sent up from the kitchen in between meals. If you'd like to set that up, you can simply talk to your tray passer about that, or you can ask the nurse to send a message down to the diet office as well. Also, we do have high calorie, high protein food and liquid supplements available here. We have several different options. We also can make milkshakes as well. They're not necessary for everybody, but I do think in those instances, for those of you who just aren't feeling well and maybe you're only able to get a few bites in at breakfast or lunch or dinner, for example, it might help to order one of those if you anticipate not being able to eat much of your meal. And just so it's something that'll go down easily, it's something soft or it's in liquid form. And just kind of work on that until your next meal, and then try again at your next meal. It can just be helpful, just again, to give your body the nutrients that it needs right after surgery to heal properly. Which does bring me to my next topic. I do really recommend trying to order good sources of protein with each of your meals. That would mean eating 1 or 2 good sources with your meals, and then maybe consider having 1 or 2 high protein snacks in between your meals, or maybe a snack before bed, and focusing on those really good sources of protein that come from any of your lean meats, poultry, fish, any other animal products like eggs, cow's milk, or milk products like yogurt or cottage cheese, or even cheese sticks. It could come from peanut butter, beans and legumes, like if you think of kidney beans or black beans, garbanzo beans, or hummus that's made from garbanzo beans. We do also have lactate milk available here for those of you who might be lactose intolerant. We have soy milk and nut milk available as well, which are also naturally lactose free. Excuse me. And soy products in general are a good source of protein as well, whether you get it from soy milk, tempeh, or tofu, just to name a few. So again, getting enough protein in your diet after surgery is going to help heal your new surgical wound. Just because think about it, they are cutting through tissue. Your body's going to need a little more protein than normal to help heal that up. And protein is also going to just help to maintain your lean muscle mass as well, especially as you're getting up and you're working with physical therapy a little bit more and walking a little bit more. It's also a good idea before and after surgery to just, eat a few extra servings of some of those high iron containing foods. It may be expected for some people to experience some post-operative anemia. It will correct itself with time, but it can help to eat some of these higher iron containing foods, whether it comes from fortified cereals or other fortified foods. Just check the nutrition label, go to the bottom of the label, search for iron, and make sure it has at least 10% or more iron per serving in that fortified item. Other good sources of iron would include leafy green vegetables, as mentioned, beans, whole grain foods, and as many people know, red meats are a great source of iron, but so are any of the other meats and poultry and fish as well. And some good sources of vitamin C from your diet, just to help promote iron absorption, would include citrus fruits. Bell peppers are actually a great source of vitamin C, tomatoes, and berries, just to name a few. Another thing that I can't emphasize enough after surgery, especially while people are taking pain medications, is making sure you are drinking enough fluids, just because pain meds tend to slow down the GI tract a little bit, which is what's putting you at risk for becoming constipated. Some of you may need to actually take stool softeners and laxatives in the hospital and for a little while you go home and you're still taking pain medications. But again, nutrition-wise, really pushing your fluids and getting enough fiber from your high fiber foods like your fresh fruits and vegetables and whole grain foods will absolutely help with that. In general, for most people, I recommend getting at least 7 cups of fluid in a day. Again, it could come from water, tea, seltzer water, other foods that melt at room temperature like Jell-O, popsicles, Italian ice, anything like that will contribute to fluid intake as well. But again, just making that conscious effort to be sipping on fluids all throughout the day will hopefully help with that issue. And just kind of a side note, it can be helpful for quite a few of you, I think, to just consider maybe making some meals ahead of time in the next 1 or 2 weeks coming up to your surgery. Again, just to ensure that you're eating well and eating regular meals throughout the day when you go home after surgery. Just keeping in mind that you probably won't feel like going in the kitchen and making any meals from scratch for at least a little while. So you could just cook up a batch of any of your favorite meals that are going to freeze well, individually portion them off in little bags or Tupperware containers, so that way when you go home, all you have to do is take it out of the freezer and throw it in the microwave. Again, it's just another way to just ensure that you're eating well after surgery. And we really don't want any unintended weight loss, just because that can impact the healing process as well. And then just a few dietary supplements that should be discontinued before surgery, just because some of these could have a number of different interactions with medications, but a lot of these in particular could have an effect on some blood thinning medications, which you will be taking after surgery as well. But specifically, they're usually looking for fish oil or other omega-3 supplements, any herbal teas, such as like dieters teas, detox teas, any teas that you might find in the store that have a specific claim on it that they claim to help with a specific ailment. Otherwise, most other teas are okay to continue drinking. Any herbal supplements like ginseng, ginkgo biloba, garlic or turmeric pills. I'm really not concerned about people adding spices and herbs to food for flavoring. It's only if it's in pill form that it's of concern. Also, they're looking for vitamin E pills, especially if you're taking vitamin E on its own and it's over 400 international units per pill. But they will probably tell anyone to discontinue multivitamins as well because they do contain a small amount of vitamin E. And if you're not able to get a hold of somebody to ask about a specific herbal supplement or other that you might be taking, it's always better to be safe than sorry and discontinue it. This is anything that's not a prescribed medication, just to be safe, again, because it could increase those effects of some blood thinning medications that could possibly put you at an increased risk for bleeding during surgery or after surgery, which is of course of concern. And last but not least, I do just excuse the late post-op diet on there. Usually people are upgraded to actually what we call our general diet here, usually within 24 hours after your surgery. A general diet simply means that there's no therapeutic restrictions. Some people might be placed on a therapeutic diet at the discretion of their doctor, like low sodium, for example, if you have a history of high blood pressure or other heart disease. However, if you do wish to be placed on a therapeutic diet that you're following at home, you can absolutely request to be placed on that. Just mention it the day that you come in for surgery, just because the doctor has to put the order through. And you can always double check with your nurse on the floor, or you can ask the tray passer. But just so everyone knows, once you get your menu for the following day, your diet will be printed at the very top of that menu, and you can always look there and see what diet you're on. And if you have any other questions or you wish to speak with a dietitian before you leave, you can always ask the nurse and they can send a consult down for us as well. But that is it for me today. Best of luck to everyone.